Hi, I'm Dr. Julie Steinauer. National Concussion Awareness Day is September 16th this year. We're going to talk about concussions in this video, but first let me tell you how you can connect with us. If you're local, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and you can schedule a consultation to find out how we can help you after you've had a concussion. Now, there are 3 R's to the healing process of concussions. The first R is rest. The second R is reduce your screen time, and the third R is restrict the activities that you're doing. Those are 3 of the traditional ways that we know to heal from a concussion. Unfortunately, there's just not a ton of information out there about what kinds of treatments can you do, what would be beneficial. So the 3 R's are what we hear most often, but that doesn't mean that there aren't other things that you can do. And I'm going to talk to you today about Syntonics and vision therapy. But let's walk you through first what are some of the symptoms of a concussion. So many of our patients will experience nausea, lightheadedness, dizziness, maybe even vomiting. Some patients will say light sensitivity is really a problem post-concussion, or they feel like they have problems with focusing, maybe even stability with walking and standing up could be an issue in severe cases. Now let's talk about that. There are actually 3 different levels of a concussion. There's a mild, moderate, and severe. In severe cases, the person is going to pass out and lose consciousness for a certain amount of time. In a more mild or moderate level of a concussion, what happens is that they might be disoriented for a period of time, let's say 15 minutes. So if it's considered mild, it's less than 15 minutes and they don't pass out. If it's more of a moderate level of concussion, they may be confused, disoriented for about 15 minutes or more, and they also don't pass out. So really the time limit is kind of 15 minutes, either below for a light level or above the 15 minutes for a moderate level, and severe is they do pass out from it. Now again, the 3 R's are something that we traditionally hear about, that rest, restriction of activity, and also reducing your screen time. But we're going to add something to that, which is Syntonics and vision therapy. Now after a period of time of maybe a day or 2 of resting, or depending upon the severity of the concussion, we do want to jump into an active phase of restoring normalized vision and helping that person to be able to get back to their main activities that they want to do. Many patients post-concussion will continue to have some sort of symptoms long term, and so it's even not that a week or so goes by, or 2 weeks or 2 months or 3 months or 4 months, and that person may still have some symptoms that are lingering. Well, then it's definitely time to move past restriction of what you're doing, rest, reducing your screen time. You may still need to do those things for your overall health and well-being, but we also might be needing to add the visual component. So when we use Syntonics, we're using a specialized lens that is specifically designed to be able to help our patients post-traumatic brain injury or post-concussion. This filter, whenever worn by the individual who's had a concussion and looking at a light at the same time, will help to begin healing the brain and allowing the brain to make normal kind of electrical or neuro connections within itself again. Now there are other things that we utilize besides just the first healing phase of a lens, so there are many other filters that we go through. But even the process of just taking their glasses off, which by the way, after they've had a concussion, they might not want to wear the same glasses or contact lenses they've been used to. They may feel they're too strong, or they may feel that there's something just not quite right about wearing them. That's okay for them to go without during those times, because if it provides them with more comfort and they feel more relaxed without the glasses, then just remove them. Now with Syntonics, you're putting the goggles on, they're looking at a light source, but some of our patients post-trauma or post-concussion will actually be really sensitive to light, and so even having the goggles on and trying to look at a light will be really disturbing. In some instances, we'll tell you use a very low level of light, like a super low wattage of a light bulb when you're doing the Syntonics. In other cases, we might actually recommend that when you have the Syntonic glasses on, you have a light on in your room, but you lay there with your eyes closed. Now many of our patients are like, what? What does that do? How does that actually help? Well, your brain is still receiving input of visual information and color even if your eyes are closed. So you can still get the benefit of the Syntonics with your eyes being closed. And it can be a much kinder and gentler way to address, again, restoring the brain's kind of neuro connections with itself after you've had a traumatic brain injury or concussion. Now, once we go through a phase of utilizing Syntonics to help kind of heal the brain and get things a little bit back to normal in terms of how the brain is processing information, then our next thing is to add an on-hand, kind of like hands-on component to things. And this is where we're going to assign you to a therapist to work on specific activities based on the resultant visual problems that you're still having, like how your eyes are lining up, how they're working together as a team, whether or not they're having issues with tracking. There are all kinds of filters that can address these individual visual problems. Now, if this sounds like something that maybe you need, or maybe someone that you know and love had a concussion needs or traumatic brain injury, then contact us. If you're local, you can call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and we would recommend that you schedule a consultation directly with me. Once you click that button, it's going to take you through the next steps of paying for the consultation and then telling you what you need to do for that consultation, as well as scheduling the time with me. Now, if you like this video, hit the like button. If you haven't done so already, please make sure to subscribe to our channel. That way you're not missing any of our notifications of videos we put out. And as I always state at the end of my videos, but particularly important with videos like this, make sure that if there's someone that you know in your life who's had a concussion or had a traumatic brain injury and you feel like they could benefit from this video, please pass it on to them. Thank you.